Welcome to online training for staff that require view-only access for the AEHR Electronic Medical Records System. During this course, you will learn basic functionality and navigation as well as printing, faxing, and other functions you will need in the system. To begin, we must first log into the system. Click inside the Login field and enter your LinkBlue ID. Next, enter your LinkBlue password and hit New Session. Do not use the Last Session button or Option buttons. By default, you will begin in the Daily Schedule screen. The first thing to point out is the importance of logging off or locking your AEHR session whenever you walk away or are no longer using your computer. HIPAA law requires it, and patient confidentiality concerns should be at the highest priority when working with medical records. Click Log Off or Lock by clicking Lock. You simply re-enter your password and click Resume to return to AEHR. Now, let's talk about some of the main areas of the Daily Schedule screen. The Daily Schedule shows patients with appointments scheduled for the chosen date. AEHR will default to the current date when you first log in. On the left is the vertical toolbar. This shows the different sections of AEHR. The items in this menu determine what tabs are available in the horizontal toolbar, where each tab is a subsection of the section selected in the vertical toolbar. These tabs change depending on what section you have selected. The patient banner appears across the top of every screen in AEHR. It contains basic information about the selected patient. The basic demographic information and the appointment comes across from our registration system, APM. Since we do not have a selected patient yet, it is empty. The status bar appears at the bottom of the screen. It identifies the username and site for the user that is logged in. It also includes the selected encounter or the appointment date and type. The clinical toolbar is where information is added to the patient's chart. When not incorporated in another section of AEHR, like the clinical desktop or note, it will be in a floating state. To hide, simply click the X or click Tools. Then Show Hide Clinical Toolbar. To bring it back, repeat this process. It is important to be sure that the site selected in AEHR is where you are working. If you change locations, you must also change your site so that print jobs print to the correct location and the site that appears on printed notes and orders is correct. Each clinic has determined sites that are appropriate for them. Sometimes it is physical sites where outreach clinics are located, while other times it is pods or divisions within one physical location. To change sites, click User Options on the vertical toolbar. Click Select Site. Select the desired site. And click OK. Notice that you can see the current site in the status bar at the bottom of every screen. Click Chart on the vertical toolbar to return to the daily schedule. In most circumstances, you will select a patient from their scheduled appointment. If perhaps the patient is not in the clinic that day, you can use the Select Patient option. To search for a patient, click the Select Patient button in the patient banner. Click Search. It is possible to search for a patient by name, date of birth, medical record number, phone number, or social security number. When searching by patient name, you can include a full or partial last name, or include an optional full or partial first name. If searching by medical record number, you must enter the entire medical record number, which will be 9 digits. In this example, we will search for patient Amanda Potter. Using abbreviations will help you get better results. Enter the name into the search box. Click Search. Select the correct patient, then click OK. Notice that the patient we selected is now the patient in context and their information is populated in the patient banner. The preferred method of selecting patients is by using their scheduled appointments. To do this, we must first locate a provider's schedule. To search for a single provider's schedule, click the All button to the right of the provider dropdown. You can search for providers using the format last name, comma first name, or just by their last name. Click Go. Select the desired provider and click OK. The chosen provider's schedule for today is now visible. The provider's daily schedule shows the patients who will be in the office today. To select a patient from the daily schedule, single-click the patient. The selected patient is now in context and their information has populated in the patient banner. Note that if we click the Select Patient button, previously searched patients can easily be selected again from the drop-down menu. To view the clinical desktop when a patient is searched for and does not have an appointment, click the Clinical Desktop tab on the horizontal toolbar once the patient is in context. To view the patient's clinical desktop when a patient is selected from the daily schedule, double-click on the patient. Click Chart on the vertical toolbar to return to the daily schedule. Now let's review navigating dates in the daily schedule. The Days of the Week banner allows viewing of the schedule for other days during the current calendar week. The arrows on the right of the Days of the Week banner move 1 week forward or backward, while the Go to Today button returns you to today's schedule. The Calendar button next to the currently displayed date opens to allow more specific date selection. You can jump by days, weeks, months, or years. By clicking and holding the bottom right corner, you can drag the calendar out to reveal more months to select from. Click the Today button to return to today's date, and click OK. The schedule will automatically refresh every 5 minutes. To manually refresh, click the blue Refresh button. There are 2 ways to view multiple providers' schedules simultaneously. The Provider Schedule tab will allow users to view up to 4 provider schedules side by side, while the All Providers schedule will allow users to view up to 40 provider schedules in one combined list. To view up to 4 providers side by side, click the Provider Schedule tab. To select each provider's schedule, click the All button in each provider field. Type the name of the first provider using last name first. Click Go. Select the provider. Then click OK. You can repeat this process to view schedules in each of the provider views on this page. You can set default providers to appear every time you view this screen. To do this, click Personalize. To set defaults for the Provider Schedule tab, use the right side of the window that appears. If you have recently searched for a provider, their name may appear in the drop-down menu. You can repeat this process for the remaining default providers. When you have finished choosing your defaults, click OK. The selected providers will now appear as the default providers anytime you click on this tab. The All Providers Schedule view is used in the Daily Schedule tab. This should also be personalized if you wish to view schedules of more than one provider by default. In this view, you can add up to 40 different providers. To do so, click Personalize. To set defaults for the All Provider Schedule view, use the left side of the window that appears. Click New. In the text field, enter the last name of the provider you wish to add, and click Search. It may be necessary for you to scroll to find the desired provider. Click More to advance the list further. Click the checkbox next to the name you are searching for. Notice that the name populates in the box to the right and the checkbox is empty. You may continue to search for more provider schedules by repeating this process. When you have finished adding providers, click OK. And click OK in the main Personalize window. To see the All Provider list, click the arrow in the Provider field and select All Providers. To view a single provider schedule, click the drop-down arrow and select the provider. Next, let's talk about the information displayed on the daily schedule screen. The $, or charge status column, will display a green $sign if charges have been submitted for this visit. The N represents the note status. If a sheet of paper appears in this column, the note has been started for this visit. If the note has a green check mark over it, then the note has been signed and finalized. TC, or Transition of Care, and SOC, Summary of Care, are part of Meaningful Use Stage 2, so are not yet used. CS stands for Clinical Summary. The checkout staff will use this link to print a clinical summary for the patient. A clinical summary is a requirement of meaningful use. Every clinic will be printing a clinical summary and distributing it to patients as they leave their appointment. A indicates appointment status. When a patient arrives in the clinic and the front desk completes the registration process, this column will show a green ARR indicator to let the clinical staff know that the patient has arrived and is ready to be roomed. You will see other status such as PEN for pending in this field. Patient location indicates which exam room or clinic location the patient is in. Patient status indicates what stage of the appointment the patient is in. Appointment time is the time the appointment was scheduled for. The patient's name. Appointment type, which identifies the type of appointment scheduled. These appointments are for established patients and scheduled for 30 minutes. Appointment duration is the amount of time the appointment is blocked off for. The task column includes the number of currently active tasks about the selected patient. Tasks are clinically relevant messages that users send to one another from within AEHR in place of patient care-related emails, Post-it notes, SharePoint sites, etc. Notes from the scheduler about why the patient is being seen today is displayed in the comments column. The patient profile contains demographic and patient care information such as insurance providers and care teams. To open the patient profile, click the Patient Profile blue eye in the patient banner. The Patient Profile dialog window is displayed. Per UK's legal department, there should not be any information in the FYI section. Information that is important for the staff to know about a patient while they're in a clinic can be entered in the Chart Alerts section. When entered, chart alerts will appear below the clinical toolbar anywhere in the program where the clinical toolbar is visible. The Demographics section displays information such as address, phone number, primary care provider, and other information that is entered in the APM registration software. The Patient Care Team link will display everyone that is involved in the patient's care. To exit the Patient Profile section, click Cancel. Now, we will go over the different sections of the clinical desktop. On any tab, you may double-click on an item to view more information about it. To open the chart, double-click on a patient. The Problem tab shows the patient's active problems, past medical history, past surgical history, family history, and social history. The Allergies tab shows the patient's medication and non-medication allergies. The Meds tab shows all of the patient's medications. The Vitals tab shows the patient's past vital sign readings. The most recent vitals are the furthest to the left. The Immunization tab shows any immunization records we have for the patient. The Documents tab displays any visit notes created by providers, nurses, and specialists during patient visits. Some SCM notes will also appear here. The Results tab displays any results that have come back on the patient. HMP, or Health Management Plan, allows clinicians to quickly review and manage problems, current medications, reminders, and recent results for the selected patient. This tab will display an overview of the patient's problems currently being treated. The Orders tab displays any orders that have been placed on this patient. Graphs displays flow sheets of information on a patient that have been selected by the clinic. Visits will display all of this patient's past and future appointments within any clinic in the UK system. The Fees History tab displays all of the encounter forms or fee tickets for this patient. Correspondence and Administration displays all correspondence and administrative documentation for the patient, including letters, return to work notes, phone call documentation, etc. The Outside tab displays any medical records from outside the UK healthcare system. If the records are scanned, an S will appear to the left of the file. To print documents, the process works for any documents in the chart, including from the Documents tab, Correspondence Administration tab, Outside tab, etc. Right-click the document. Select Print, then select it from the menu that appears. If the printer information on the print screen is correct, click OK to print the document to the selected printer. Since this is a training module, we will click Cancel. Faxing uses the same general steps. Right-click on the document you wish to fax. Select Fax. Type the recipient's name in the To field and the number in the fax number field. To print medication list, click the Meds tab on the clinical desktop. Right-click over any of the medications on the med list. Select Print Medication List from the menu that appears. Click OK to print to the default printer, or click Preview to print to the default printer for your computer. If you need to print order requisitions, this can be done by clicking the Orders tab on the clinical desktop. Right-click over the order that you wish to print a requisition for. Select Print Requisition from the menu that appears. Since this is a training module, we will click Cancel. This completes online training for staff requiring view-only access using AEHR. If you have any questions, please contact the UK Healthcare Help Desk at 323-8586.